Fine with that. If Thomasina and Elodie, are you okay with being recorded? Okay.
Okay, yes. So World Outreach began January 14th, 2006. The full name, we kind of shortened it to World Outreach Center, WOC, but the full name is World Outreach and Bible Training Center. And our pastors, they have been trained. They went off to seminary, they studied several things. And, World Outreach Center, as a result of their vision, has a 4 point mission, and it's win, men, disciple, and send. So the winning part, of course, is bringing people, to Christ, improving their spiritual lives. The mending part is realizing, and that's kind of like where I come in with the team that I lead. The mending part is when people come to church, when they, join any organization. Usually they're coming with some issues from the past. And so one of the ways that we help with that mending part is the biblical counseling team that I'm the director of at World Outreach Center. But of course, people get mended, in faith based communities through, the Word of God, through the services, and we have services on Sundays. The interesting thing about it, the pandemic has offered a wonderful opportunity. Instead of having our traditional Wednesday night service, we now have what we call a house church. And so that leads to the other part of World Outreach and Bible Training Center. We have trained up individuals to be able to use a video sermon that the pastors have curated to host like a gathering in their homes. So some of the gatherings are in the homes of members who have taken on the leadership role, and other gatherings happen virtually. And this has been what the pandemic has offered us, to have the opportunity to continue fellowship, which has been phenomenal. And I know a lot of faith based communities have come up with other strategic ways to stay engaged with the people. And that is how we have done it. And it has worked out wonderfully. So that's one of the mending. The differences with the mending component right now. We also have small groups. Small groups in our ministry can be on various topics of healing, topics of health. We've had small groups on people in the congregation who use keto, the keto diet or the keto living style. And so they have a small group for people who are interested on that. We have a small group about overcoming different medical issues, mental health issues, and then just various topics. So that's another component of healing and also fellowship. So when men and then disciples, so the discipling part, is more of that training part. Pastor Irvin Henderson and Melva Henderson are our pastors, and Pastor Melva Henderson started the training part of the ministry. So there actually is a World Outreach Bible Training Institute, and that's where a lot of people receive their discipling and their leadership skills. And then the fourth part of our ministry is the sending component. So after somebody has, had the opportunity to serve in different ways to help with the healing, the wellness, the mending, the spiritual development of individuals, and they go through training, the mission of World Outreach Center, which has been different from any other faith based organization I've been connected to, is that people are expected to be sent out into the mission field, the marketplace, in my case, university setting, wherever it may be, and continue the work of what they have learned. Currently, we have, right now as I speak, we have some missionaries from our church in Ghana, Africa, delivering supplies, laptops to individuals, spiritual guidance, healing, prayer, and all of that. So that's actually going on as I speak. And we have several missionary partners. We partner with missionaries that are not necessarily members of World Outreach Center. One of the big things we have is the Milwaukee Give event. It's usually 2 events a year, in the summer and then in the fall or winter. And approximately 55,000 people have been served since the inception of World Outreach Center, people in the Milwaukee community. And then, according to our statistics, about 15,000 individuals have gone through our discipling component. 5,000 plus individuals have been trained and sent out into the various aspects of society to continue fulfilling the mission that they have adopted and continue to carry out in their particular area of specialty. And then approximately 4 churches have been planted all over the U.S. So that is what we do. It is a multicultural and multi-generational church located in the city of Milwaukee and now transitioning also into the Oak Creek area. So, we do embrace all aspects, as I said, of spiritual, physical, and mental health. So when Dora came with this project, of course, it was a no-brainer that we were partnered with her to talk about sickle cell. And I can share that one of the greatest aspects that I got out of it is seeing the relationship between sickle cell, the health condition, and also the mental health aspects of that. And I'll stop there and save the rest for later. Thank you.
Thank you, Thomasina. And then, Elodie, if you want to give just a brief background about our sickle cell community, what you think would be significant to share um, and enlighten us, because, there may be some things that you are current on that I may not be current on, but just a little bit of the history of the past, the current, and future state of our sickle cell community.
Okay, so as I mentioned, I work for Versity, and I'll start with current state. Right now, the work that I do really focuses on how we engage communities of color and encouraging people to be donors of blood and organ, especially on the sickle cell side, because we found that there's a specific what they call RH subtype called RO that specifically treats sickle cell patients. So our goal is to go out into the community and encourage African Americans, Hispanics, and Latinx people to donate blood, because this specific subtype of blood is found in 44% of African Americans and 15% of Hispanics. So what we're currently doing is partnering with churches, the Divine Nine in Milwaukee, and other community partners to really establish a presence for Versity to address treatment and the importance of donating in our community. The other thing that I'm really passionate about is, and now this falls into past, is I really would like to see Milwaukee or the state of Wisconsin move towards a really strong presence for sickle cell disease in terms of an organization. We have the Medical College and children with strong sickle cell programs. We have organizations like ISCNAPA and the work that Dr. Clayton Jones does. And we have organizations like Versity, but we're not all one entity working together for the greater good of sickle cell disease. And there are many ways that can look like. My greatest hope is that we're able to come together at a table and discuss each organization's key strengths, and those key strengths will then be tapped into to really be able to garner the resources and have a greater impact on the sickle cell patients that are currently living in the state of Wisconsin. Although Versity is also in 4 other states. So maybe that framework or that structure could be taken into Michigan, Indiana, Illinois, and Ohio. But what I noticed here is our audience, I think it also just might be because of the way that the city is divided and the way that we're segregated. It's really difficult to bring people together for certain things. And it makes sense that different people develop different organizations, nonprofits, to provide the resources that they want within their communities. So I would really like to be able to establish that strong presence for people to come to. The reason why I was really excited about talking today is because one of the pieces that's important to building that strong partnership is the academia setting. We know that research informs policy. We know that research can also inform pharmaceuticals and cost of medication and treatments. We know that research can inform different social determinants of health that affect sickle cell patients. But we also know that if sickle cell patients are treated well, racially, who are treated well in clinics and are provided the right care, that those structures can be then transferred to everybody else. So we're not just helping the sickle cell community, we're helping those patients who are most underserved and underrepresented in our communities. Having a focus on sickle cell disease is just my mission, just because, well, I don't have sickle cell anymore because I just went through a bone marrow transplant. But that's where I see academia having a space in bringing all of our heads together to really empower all of the ideas that have been brought to the table, but were never really achieved because of lack of capacity, because of lack of resources, and there's never really a lack of effort. The effort is there. I just feel that we don't have a way to amplify those efforts and provide the added energy that's required to really push an agenda forward. So I also what the other thing I wanted to bring up was just the different health services that are taking place within the community in Milwaukee, especially. There are different ways for someone to receive services, but do those services really address the current needs and the current asks of the patients? I know Dr. Clayton Jones will go into a little bit of our focus groups that we've discussed, that we've done in the past, and some of the things that sickle cell patients have brought up as to what's important to them. And so kind of addressing the health services that are currently offered and health navigators that are in the community, how they're also serving sickle cell patients truly and making a true impact in their lives. Because I can go into being a health navigator can be also really difficult. What does that pay? Do they have good mental health? Do they have good transportation? They tend to have 2, 3, 4 people that they care for. And so that in and of itself can transfer with some negative effects just in the way that they work to the patient if those health navigators also are not supported. So that's kind of where my head has been. It's all over the place, but it comes together in many different ways because there are many paths.
Thank you so much, Elodie. I appreciate what you've shared, and Elodie, I'll talk a little bit more about our relationship, but in addition to being kind of introduced by mutual friends, after that point, Elodie also became a project manager for the first project where we really did focus groups in the community and was present for every focus group and was a co-facilitator. She didn't need much training from me. I think that we made sure that you had the city training, but in terms of, like moving it forward and facilitating things, she really didn't need much training from me, but she was present at every focus group meeting, very much an integral part of um, the outcome of those meetings and really setting the atmosphere. We wanted to make sure that those meetings were held at a place that would be convenient. And so even identifying spaces that were central within the city that were not, within the hospital setting or within the academic setting, but community spaces. I'm going to share a PowerPoint and just to kind of talk a little bit more about those relationships, and then Thomasina and Elodie will go into, their thoughts about what's important for establishing partnerships. So let's see if I can get this shared. I think that's it. All right, are you guys able to see my see our PowerPoint here?
No,
Can't see it yet?
no.
Nothing? Okay, let me try this again. How about now?
No, it's thinking though.
It's thinking?
No, I think it's just you.
Okay.
It's like showing a screen, but not.
Right, it's still just your name on the screen.
Yeah, it looked like it was gonna go, but it didn't.
Okay, let's try something else. Let's see here. It's interesting. Let's see. Let's try another window.
Yep,
There it
got
is.
it.
We can see it.
I think when I have it in full presentation mode, it doesn't show. So I'm going to leave it like this and just go through the slides. All right. This first slide, I'm not going to even spend a lot of time on it because we know the status in Milwaukee and Wisconsin. When we think about our Black communities, when we think about our Latino communities. And so our aim is to really focus on the assets. We know what the stats are. And so we want to not always start out with, what the negatives are or what the media says or what, the negative perceptions out there are. So moving to focusing on assets within our communities. And so I really purpose to understand the gifts and talents of our sickle cell warriors in interacting, understanding that Elodie speaks French and I think maybe 4 or 5 languages. Understanding that Evelyn is very much skilled in doing broadcasting. Understanding that Kendall is a graphic artist. So understanding the gifts and talents of sickle cell warriors who are, to me, some of the most talented, resilient, knowledgeable individuals you will ever meet. I am still president of ISCA-NAPA, the International Association of Sickle Cell Nurses and Professional Associates, and we award 5 scholarships every year. And when I tell you, it is the most difficult decision to come up with who to award 5 scholarships to, because we usually have about 30 to 40 applicants nationally. They all deserve a scholarship. They all have a 3.5 grade point average or above. They are all volunteering and doing service at their institutions and in the communities, even in the midst of having sickle cell disease. So I am always amazed, and I wish I could give every single person that applies for a scholarship, and maybe that'll be the entrepreneurial side of what I do next. in the next 5 years. Um, Understanding the resources of faith-based and service organizations, understanding what the strategic plans are. I spent some time meeting with key leaders of faith-based organizations. I met with the Hendersons, who are the pastors of World Outreach. I met with the people at Christian Faith, the church where I'm a member. I met with Pastor Marlon, who is a member at Unity House of Gospel, and his wife. And so 3 faith-based organizations, really understanding what is what is their strategic plan around health, around community engagement, and what their goals were, and just really great getting an understanding of their resources as well. As Thomasina shared, as you heard how resourceful she is, and so there are some amazing and resourceful professionals within faith-based organizations, from nursing to counseling to corporate to, um, arts, just leadership, administration, just so many gifts and talents, and it's important to understand the resources, but it's also important, equally important, if not even more important, to understand that even with those resources, understanding that when you are serving underserved, marginalized communities, you are working double time, triple time, or quadruple time to serve those communities. And so that, with that being said, it's important to support them financially and with bandwidth, because they're often burned out with COVID even, giving that as an example. The pastors in World Outreach said we've received 4 to 5 times as many calls during COVID about needs. So realizing the impact that COVID has on all organizations. We feel COVID in our academic setting, in our other community settings, but realizing too how other organizations around us are impacted. Um, University support, and I've been funded through the Office of Community Engagement. I've been funded through Marquette College of Nursing, to do the pilot studies that we've done with focus groups and that. And most recently, I received the funding from the Betty Irene Moore Foundation, which is the largest funding that I've received. And I'm really grateful for the impact that this funding will have um, on young adults living with sickle cell disease. Corporate support, while it's I think about the foundation in terms of that too, because there's overlap. I mean, Gordon and Betty Irene Moore, they're philanthropic givers, and because of them, that supports me with this fellowship for the next 3 years. And so all of those are important. And I would say, even being in this fellowship role, I'm realizing that I don't have to always spend all of my time on the community engagement part, which is important, or on the academic part, which is important. But now starting to bring in the corporate and the entrepreneurial lens, and considering what can I do even in that role to improve situations, improve conditions, to offset and try to mitigate some of the burden that's carried by our organizations that are doing an abundance of work and service. Um, so partnering with organizations, and this is kind of, this was like our kickoff. We had never hosted a sickle cell empowerment conference in Milwaukee. Other cities have. As Elodie pointed out, we don't have a formal support group organization that would kind of house activities and be a voice for Milwaukee, for our sickle cell community. And so many of us are doing what a support group organization would do in our various roles. And we try to connect at different points. Many of us are serving on the same advisory board. I'm on the advisory board with Elodie as well. And so there's actually 2 advisory boards that we kind of share. But in thinking about partnership development, this was really important. And and thanks to the funding that was provided by the Office of Community Engagement at Marquette, we were able to do this Sickle Cell Empowerment Conference where we offered a little more than a half-day event where we covered topics that were identified by to include mental health, to include emergency room advocacy, to include healthcare transition from pediatric to adult care, and to include social action because we know policy is what drives change. We can do all of this work in the community and in our academic roles, but we cannot negate. We have to keep in mind that policy is important, and so when we hosted this conference, we had Leader Taylor, who has been an advocate for sickle cell and talks about a family member who lived with sickle cell. Elodie Antala, who is with us today, she and her mom, Fauza Youssef, they were part of the healthcare transition and just really talking about the needs for adolescents and young adults as they move over to adult care. Ed Jenkins, he grew up in Milwaukee. He now lives in Minnesota, but he lives with sickle cell, and he's also very much vocal about emergency department interactions and needs. I've actually included him on the current project that we're working on because of his experience. He's going to help us with the simulation and developing that simulation activity, which would be an emergency room encounter. He has a bachelor's in fine arts. So he's also going to help us with the acting part of that when we make that virtual. And then he's also a youth pastor. So being a warrior, being a youth pastor, again, when I say knowing the skills of those among you is important. He's so fully skilled. Anita Holloman, who also is a member of World Outreach Center with Thomasina, and she is a licensed professional counselor. And so they were all our speakers. We also had people from a representative from Children's who was there. Dan Bergen showed up to give greetings at the beginning of the event. And then in addition to World Outreach and Marquette University, Global Therapeutics provided meals for that day. So I submitted for a grant. They said, you know, hey, we'll give some money toward the lunch. And so our lunch was covered because of that grant. ISCANAPA, the organization for which I'm president, also made a contribution for some of the items that individuals would take away with them that day. Senator Leader Taylor was, like I said, one of our speakers. The Top Ladies of Distinction in Milwaukee and the Top Teens of America, that's the women and the teens organization. They work together and they're really much engaged in service. And so they provided, they were there and available, and they served as ambassadors, greeting people as they came in that day, and just addressing any needs, checking people in. They were so helpful, very helpful group. And then Strength in Sickle Cell, which is an organization that was founded by one of our sickle cell warriors in providing assistance with the program that day as well. So moving on, this is our focus group, and this was actually, we had 2 focus groups that night, and so that was our 4th and our 5th focus group. We had a total of 5 focus groups, and so the 4th and the 5th being on that night, we had our young adults in one group, and then we had parents and healthcare providers in the other group, and then Thomasina was one of the healthcare providers in the other group, but also coming with the lens of being a member of World Outreach Center and really providing a perspective of what World Outreach Center could do, you know, in even learning even more about the situations that warriors face. Then to continue the community engagement, to continue the presence, the warriors said they really wanted a day of prayer and to make that available for all. And so we on World Sickle Cell Day, we organized a community prayer, and I was I facilitated at Jenkins, as I said before, who is a sickle cell warrior, is also a youth pastor, and he prayed for those that live with sickle cell disease. World Outreach pastors, Melva and Irvin Skip Henderson, and just really praying for the community and their role in supporting the sickle cell disease community. Blaylark, she's the founder and director of the Sickle Cell Foundation of Minnesota, and she prayed for the parents. And then India Marie is a psalmist, so she's a beautiful singer, and she's also the daughter of Marlon and Kimberly Locke, who are the pastors of Unity Gospel House of Prayer, and I think they're probably about a mile from Marquette, so they're really close to campus. But she opened up with her. She actually released her single that day about victory, and so everyone. I think we had over 500 attendees for that event. Um, we did not do it for 2021, and people are asking if we're going to do it for 2022, and so we're still deciding if we're going to do that one for 2022. And so those are just some examples of things we've done. And then just thinking too about ongoing partnership and being present in the community. People knew me as a registered nurse at Children's. I worked for Children's for over 10 years. I worked as a nurse on the floor. I worked in urgent care, emergency room. I floated all throughout the hospital. And then I worked as a nurse practitioner in urgent care and in school-based health center. But people did not know me as a researcher, an academic. And so engaging in individuals on that level and making sure that we have a presence and we remain consistent in doing that. And so here's just a picture of Lena Taylor when she was presenting for the Empowerment Conference. Here to the upper right is a sickle cell warrior, Antonia Perry. We were at the Milwaukee County Supervisor's Office, and we were giving testimonials about the need for having Sickle Cell Awareness Month in Milwaukee County. And that resolution was drafted, finalized, and it passed on that day. It went forward that day. It passed on another day, but this was our first interaction where we had about 10, I think 8 to 10 people. Elodie, you can correct me if I'm wrong. But I think we had like 8 to 10 people that showed up and gave testimonials about their experience in living with sickle cell disease. And when I say there was not a dry eye in the room, everyone was passing the Kleenex box, because I think people really had no clue. Some people think that sickle cell disease is cured or that it's not an issue anymore. And so we really have to make sure that people understand that there is not a widely available cure. While Elodie received a bone marrow transplant, as she mentioned, that is not something that everyone has as a potential option. And so here is a picture of all of us when it passed as a resolution for Milwaukee County. And so we're all pictured there with Felisa Martin, who is a co-chair for the Health and Human Services Committee, Theo Lipskin, who was the chair at that time. And then this picture below, we hosted a film screening in collaboration with Freighter and Medical College, Spilled Milk, and that was during the Milwaukee Film Festival, and we did a special week around health. And so the film that we viewed, the documentary Spilled Milk, it really detailed the life of a young man who lived with sickle cell disease, and we had a panel discussion afterwards. And so these are just some examples of things that we've done in the community in collaboration with our healthcare organizations, our faith-based organizations, service organizations. And even though we don't have a formal support group organization here, Minnesota partnered with us. The Sickle Cell Disease Association of Illinois partnered with us. So even going across boundaries, but still in the Midwest. And so when we talk about developing partnerships in communities of need, it is a process, as many of us know. It takes time, and I don't even know if I can account for the time that's involved. But it is and it takes commitment. I think probably the person that can attest to it the most would be Kristen and Elodie, who have really seen kind of what it takes behind the trenches. Um, and thanks to Elodie's sister-in-law, Elodie helped me. I'm trying to remember her name. Um, but resolution, we were able to get a resolution passed and for Sickle Cell Awareness Month in Wisconsin, in the state of Wisconsin last year. Representative Shelton, right?
Yes.
It
Yes.
came to me. Came to me, Representative Shelton, and so we're very thankful for that. So those are just some examples of programs and examples of processes, for establishing connections and having understanding about needs, doing needs assessment. I am a community-based, participatory research-driven person, and even more, um, getting even more deeply involved in just really allowing people to have the stage. It's not necessarily that they don't have a voice. It's more that we don't give them the opportunity to share. And so it's really important to give people the opportunity to share. They have a voice, we just don't allow them to share, and we don't give them the platform to share. And they have a lot to say. Elodie can tell you, when we have those focus groups, we ran out of time. We ran out of time. I think people could have talked probably at least another hour or two on some of the topics that we were discussing. And so there are many needs. There are many areas where we can provide support. Um, but I think that um, having familiarity around, and I'm not originally from Milwaukee. I'm originally from Chicago. So there were some things I learned about this community, the Milwaukee community, that I didn't know before as well. Learning more about history, learning more about why there might be bad blood, why there is good blood, and not going in with any assumptions that I know everything, or that because I may look like the people that I'm working alongside with, that I know everything. I have to do that check consistently to make sure that I'm not in imposing power, imposing my ideas, imposing my thoughts about direction, but that I am working collaboratively with partners, because they are partners. They should be treated as partners. Um, and I have the utmost respect for everyone that I interact with and work with and learn from. So I don't know if there's any questions for me before we move on to Elodie and Thomasina sharing more. If not, I think that we could move in, you guys, if you want to just maybe talk about what you think are important characteristics when we're talking about partners and wanting to work with partners, and how partners should present themselves. And let's talk about the do's and the don'ts, because I think that's really, really important, because everything that we do in the very, I would say, before you even meet a partner, what they do before, what they do during that meeting, and of course what they do after that meeting is really significant. So I know you guys have a lot to share, but if either one of you could go first about what do you think is really important to keep in mind about that process.
I just wanted to add one quick question to what you just said, Dora, for Thomasine and Elodie, because like thinking back as well, like when Dora approached you, because now, you have this rich partnership, which is amazing. But like, why did you say yes to her? So tell us a little bit too, like, because now you're a partner, but reflecting back on the beginning. So, but I mean, because I think that ties into hope, what you're planning to say anyways, but I was just thinking if you could, because I think, Dora, all the work that you just described really demonstrates the principles of community engagement. You've done so much. But anyway, so I was just thinking about that too, if you could just tell us about that. Thank you.
Well, I think for me, it was initially pretty mind-blowing because, of course, I had never heard of something like this being done with a church, faith-based organization. And, when Dora approached me, I'm like, wow, really? We're going to do this in the church? How is this going to go? And then as she talked about it, it was like, oh, it just makes a lot of sense. It's a perfect fit, especially understanding, the mission of, World Outreach Center, as that particular faith-based organization, our mission and how we flow, it just totally fits into everything we do. So, at first I was just very surprised, just like when I first joined the church and found out they had a counseling team. Being a mental health professional, church was one of the places where my gift and talents seemed not to fit. And so when I first joined and I found out they had this established, that was mind blowing. And then so to have the opportunity to have these discussions about, a certain physical health condition, was mind blowing to me. But that was the place for it. It was a perfect fit. And one thing, I don't know about everybody else, I kept hearing Dora refer to the time that it took. And I think Dora can attest to the fact that when you're working with community organizations, and particularly faith-based organizations as well, the time investment is the relationship building. You have to build relationships. You can't just show up and say, hey, I'm doing this research. I think you'll be the perfect organization, and here's the agenda. You have to really get to know the people that you're working for. You need to be able to really know the pulse, of that collaboration that you're seeking. And also, as Dora mentioned, the resources. These organizations, every community, potential community partner has resources, has strengths. And actually, I think Dora probably would agree with this too, knowing those strengths and knowing those resources that the partnership already has can save you a lot of time because you don't have to reinvent the wheel. So there's a lot that they have already that does not have to be created that you are able to just build off of. And boy, does that save a lot of time. And then also, I believe that every researcher picks a focus area that they're passionate about, of course, because that's what really helps with the flow of the research. You have to care about the research topic. You have to be passionate about it. Knowing that the same passion that you have about that topic, the partner is passionate also. So I like what Doris said about, giving them a platform to talk, hearing what they have to say, because if you've picked a really great collaborative partner, you've picked someone that is just as passionate about the subject as you are, and they have a lot to say. And definitely going in with an open mind and curiosity, knowing already up front that there is a lot to learn. What you thought was correct may be challenged, but being okay with that because it's a growing experience and both the researcher and the partner learn. And so it's a learning opportunity for both. parties involved?
Well, I said yes because I wanted people to know about my story. I said yes because I wanted to learn from other sickle cell warriors. So that's kind of where it all started for me, the opportunity to work within these focus groups and learn from them, and learn from Dora about what was actually taking place. What do we actually want in the sickle cell community? Um, and from there, I got a little bit hungrier for awareness. And so I wanted to continue to put the word out. Do you know what sickle cell is? Do you know how it affects people? Wanting people to really understand that sickle cell is more than just the science that that goes behind it. Dora, I don't know if you were on the Sick Cells call yesterday, but you know, we often talk about sickle cell disease as low oxygen in your hemoglobin or red blood cells that might sickle, and you might experience stroke and organ damage and pain crises. But along with all of those terrible things comes the community and familial aspects with it. So the difficulties that come with this disease are 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 not just physically and mentally and hospital, it's also the toll it takes on your life. So wanting to be able to communicate that awareness and really making making is a strong word, but making people understand why they should care. And so then that grew to my understanding of, when we talk about building relationships, creating awareness grew to, well, how is awareness then awarded? It's awarded through legislation. It's awarded through policy changes and research and new treatments created and support created from organizations at the state level and at the federal level. And so I've kind of grown to saying, yes, I am on board with working with Dr. Clayton Jones, and I'm on board with partnering with Thomasina and getting the word out there. And but I want us to continue to go beyond, because we know that going beyond brings in more. So Dora brought up the Assembly resolution to recognize September as Sickle Cell Awareness Month. Well, now I'm working to get that completely adopted in the Senate, so they can't take it away. Now it's going to be adopted, and then when we have the program with the sickle cell data collection with the CDC, now at the state level, there's something in our state that says, oh, they have recognized sickle cell disease and they are working on the CDC data collection. So maybe we can provide more funding in research and training and treatments that might be able to be funded through federally to our sickle cell programs and our sickle cell researchers here in the state of Wisconsin. Where I am right now too is in terms of building relationships, is I found that education is an important piece as well. And the work that I'm currently doing, I'm consistently fighting for the importance of just showing up to talk. And while I'm a huge advocate for blood donation, I'm also a huge advocate for going into communities without asking them to donate blood. I'm a huge advocate for showing up with my table and my sickle cell flyers and saying, hey, do you know if you have sickle cell trait? What's sickle cell trait? And then just getting to talk about what that might even be. A lot of African Americans don't know that they have sickle cell trait until they have children. And then they don't have the choice to decide whether or not they would like their child to have sickle cell disease or not. You know, some of us may say, yeah, it's fine if my child has sickle cell disease. And some of us may say, actually, I don't want to have children with sickle cell disease. And not knowing your trait status is really important for that. So approaching community associations and community members and churches to say, we would love to participate in an event that you have. This is kind of what we're up to. What do you think? How do you think your audience would receive this information? If, for example, we are working with the Harambe neighborhood and we'd like to offer different sort of education sessions about sickle cell disease, the RO subtype that's mostly found, blood subtype that's mostly found in African Americans. But we also asked, because these families have experienced a lot of trauma, one of the things we asked was, what should we not address? Should we stay scientific about the blood, about organ, or can we go a little bit more into how sickle cell really affects families? Because we don't really want to trigger any sort of traumatic experiences that these families have gone through just by talking about sickle cell disease, because it can do that, how traumatic the disease is. We also don't want to go into when and how a person donates an organ, because these families may have lost somebody to gun violence or car accidents, and now we're talking about it without any real understanding of what these families have gone through. So when we talk about building relationships, it's really more of a, hi, I really would like to educate. Please let me know about the information that I can provide to you based on what I know, and let me know how we can both support each other. And again, like Thomasina said, time is crucial here. You have to show up more than 5 times. It's the third time, the first time you ask, okay. The second time, oh, I've seen this slide. The third time might say, what is this again? What are you talking about? The fourth time I'd say, okay, give me more information. I might be interested. And the fifth time I'd be, okay, fine, I'll make an appointment to donate blood. But it takes practice. It takes conversation. It also takes a willingness to be vulnerable, and truly be transparent about what you're doing. Because building trust comes with transparency and vulnerability. You show up in a community and say, I want to do this, but why? And you don't have a why. If your why is just work, if your why is just because I have to do this, well, it's not really going to connect well. So it's up to us to kind of figure out why we do the things that we do. And I think that for the state of Wisconsin and for Milwaukee specifically, that piece in impacting health outcomes for sickle cell patients and in general won't happen unless we really put the time into understanding our community's why. Why are certain things taking place, and understanding our true positions within that. And while my position is to encourage you to donate blood, I need to understand why you don't want to donate blood, why that may be scary for you. And then we can have an honest conversation, and I can say, well, I need 7 units of blood every 4 weeks because I have sickle cell disease and it's the treatment that's keeping me alive. I need you to donate because the best match happens within our ethnically diverse matching is important for all of us. We like to say you are your own best match. So if I can explain to somebody why they should donate blood for my sake, they should be allowed to say, well, I don't want to donate blood and I understand your position. And it creates a sort of a dialogue that can expand even on how we reach out, how we talk, how we provide different ways for people to engage to still bring home that impact for health outcomes. And sickle cell disease is really broad, right? We have treatments that just recently came out that are still really expensive for patients to afford. We have a Senate bill at the federal level that we asked for 25 million and got 2 million, or 5 million and got 2 million. We have different states and different research opportunities through the NIH and the CDC and sickle cell programs around the country but yet it still feels like it's not enough. It's not enough. It's as if we need our own cold water bucket challenge to really make Ellen bring somebody on TV and say, sickle cell disease needs your attention, because it actually, the statistics will say there's 100,000 people in the United States with sickle cell disease, or one in 365 births will have sickle cell disease, or 1 in 13 births will have sickle cell trait in the African American community. Well, what that looks like in a Black community is you know somebody with sickle cell disease, the neighbor, the cousin, the aunt, somebody. So the numbers seem minute, but in our communities they're really, really big, and they really, really impact our lives. And the support that's required for that is just so broad, and communicating that requires time and skill and effort and vulnerability, and transparency. That's it.
Thank you. You say that's it. That's substance for this entire year, um, for our lives, for our career. That is some good substance. So that you guys can understand why I just sit back and listen more than I talk. I have this quote where I say, "Many are talking when we should be listening, missing the pulse of the moment." I don't want to miss pulses because pulses move our community forward, and so it's important that I make sure that I take some time to listen, um, and be informed and be enlightened, as Thomasina and Elodie have just done that for all of us. A couple more things I want to share, and then we can certainly open up for more questions. Um, but when Elodie was talking about the awareness piece, I just wanted to share another project. I worked with um, some young adults. Let's see, can you guys see this website? Yeah?
Yes, we can
Okay,
see it.
cool. Work with some young adults in college, and wanted to promote more awareness. And they all are in Wisconsin, and they came up with the name Together for Sickle Cell. And so this website has been beta tested. It's been evaluated by teens and young adults to see if it's effective in increasing awareness. And so they created music for this website. They created a team video. They have a podcast where they are talking with sickle cell warriors and a renowned hematologist, Dr. Pace, who was actually the first female and the first African American and first African American female to be the director of the Sickle Cell Comprehensive Center at Children's Hospital. And so that podcast is on this site as well. But Tania, Shannon, and Kiera um, really did a great job in launching this pilot, and I am hoping to support them in publishing the paper and the results of this pilot website. But it is just something that was on their hearts to do, and I think they did an amazing job. So I just wanted to share that. We also have a tab with Versity because we're also working with Elodie to see if there's some things that Versity would like to post, just to demonstrate that we are in unity within our community. I also included a tab for the Posse Project, which is the project that's being funded by the Betty Irene Moore Foundation, and that project starts this summer. So I just have a save the date on there. So just trying to have a hub where we can promote awareness, where we can share information, um, and I just wanted to share what they were doing with regards to that. Elodie mentioned about the social action piece too. Like, yeah, we've had these discoveries about medications. That first we only had one, and that was like for over 20 years, and it was originally used to treat cancer. And then they're like, oh, I think this can help the sickle cell population too. But we had, after 20 years of just having that one drug, we've had other drugs that have come out, a couple more drugs, but they were expensive. as Elodie mentioned. And so that when I talk about policy, that's important too. Like I can't do community engagement without incorporating some level of social action. And one of the activities that the young adults will be engaged with during the Posse Project this summer is social action. We have Wanda Montgomery, who's the president of Brown Deer, and we have Linda Jackson Cocroft, who is on the board at Freighter, as well as the founder and editor for Black Women 50 Plus, who are going to work with them to identify their approach for. They're either going to look at Medicaid waivers for medication, or they're going to look at emergency room treatment. But either way, they're going to choose one of those topics. They narrowed it down with the advisory board to those two topics, and they're going to decide which one they're going to approach from a social action perspective, and to carry that through with making appointments with legislators and those in our local government. And so that's really important. When we talked about, she said there's 2 million, thank you, but 5 million would have been better. There's just never enough. And so in that website that I shared, there were 3 people. There was Tamia, Shannon, and Kiera. Shannon is my son. He's my oldest son. Him and my youngest son, Dorian, have actually established a foundation because they realize that financial capital is important to advance, social justice. They said, Mom, we thank you for being a nurse, but we're not going in healthcare. We're going into business and finance because we want to improve financial capital within our communities. And I just was like, okay, I'm blown away. Go ahead, do your thing. But that's their focus, that's their thing. And they really want to do something more for sickle cell. And I'm just going to let them just take the floor, because I said, one thing I want to do is be able to empower other people. And I am certainly grateful that my own children are empowered to take this step, the entrepreneurial part. They're like, Mom, you need to think differently. They even told me recently, I speak a lot in the community for awareness, to educate, and I didn't really realize the number of hours. So my son, the oldest son, Shannon, said, Mom, you should have been writing that off as in-kind donations. Did you know you could write that off? He's like, if you're not going to charge, you could at least write it off. And then Dorian's like, well, you just need to charge from now on. So, when you speak, just charge, and you could apply it, towards the sickle cell scholarships, whatever you want to do. So they're elevating me with this whole entrepreneurial corporate part that is needed to support our communities as well. And that is part of community engagement as well. And it is the part that I haven't necessarily spent time with. And so they're elevating me. So I'm allowing the younger generations to also inform me and lead me as well. So I'll stop there and see if anyone has any questions for any of us.
Dora, one thing I would like to add that I didn't get to share is by sitting in the focus group, not only, of course, did I become more educated about, the experience of people living with sickle cell, and these were parents, with children as well, and, just hearing the impact of that. But of course, as a mental health professional, I had to ask, what has it been like, dealing with this, on a mental health level, emotional level. And then, that conversation got going. And I also got the impression that question, as Elodie said, isn't always asked. It's more about the research and the scientific, aspects of sickle cell, but like, how are you doing? What is the emotional, mental health impact of this on you? And it was just really good for me to hear that, and definitely stirred something up with me wanting to do more. Because I have realized in my social work journey, the connection between physical health and mental health. I worked at a dialysis center and, spent lots of time, with patients going through that process. and then other people with different chronic, health conditions. And there is a big mental health component to that. So I know that that is definitely going to always be my lane, is another addition, to the mental health services I provide, is helping people with medical conditions, chronic medical conditions, deal with the mental health aspects that they go through with that.
I have a question, and this may be my own. I might be very naive to this, but I know, Dora, you had mentioned early on in your presentation about how it can take double, triple, the amount of time and effort to for this work. But I'm just trying to really fathom just, what some of the difficulties are. What are some of the roadblocks there? Is it like funding? Is it lack of resources, lack of participation, or trying to find partnerships? Is it all of it? Or just, just so I can have a better understanding, because I am not, just like you, I'm not from Milwaukee, so I don't know, the history or dynamics of, you hear stories, but you don't really know it if you're not living in it. So.
Sure, I can start, and I saw a little twinkle in Elodie's eyes because I know she's got some perspective on this as well, because we talk about the difficulty, the challenge in Milwaukee. Those few slides, I didn't go really into it in the beginning, but we're on the map. We're on the map for being, the worst place to raise a Black child. Having high incarceration, having high infant mortality, and so when we're dealing with those kinds of issues and challenges that are often a result of structural and institutional racism. In all transparency, that's what it is. And so we're dealing with those barriers that are in place. And then when you add, a diagnosis of sickle cell disease, in which there's health-related stigma for individuals who are living with sickle cell disease, from pediatric to adult, not just adult. We have studies that show when children go to the emergency room, whether they have sickle cell or not, if they have pain, children are not treated the same in terms of assessing their pain, treating their pain, and monitoring their pain, and oftentimes don't receive anything for pain, which is really, truly unfortunate for a child to have to be in pain when they don't have, there's no reason for it. And so we're dealing with all of that are within our institutions, that are within our neighborhoods. So moving through that, plus, the fact that they have sickle cell disease, and as Elodie talked about, we don't really know the magnitude of the impact this has on a family. When we ISCA NAPA, we hosted a roundtable session at the Sickle Cell Disease Association of America when we were in person in Baltimore at their annual conference, and we invited parents with their families. I listened to a dad who had an MBA, 2 bachelors, very educated, very skilled, but because he had a child, a daughter with sickle cell disease, the lost days of work, the lost days of school, and even though he was in corporate, he had to leave his corporate job so that he can help his wife in providing care and making sure his daughter got to appointments, and he worked 4 jobs instead of 1. When I say that blew me away, because I knew, but I didn't know like that. When he shared the struggle of being an MBA prepared man in corporate who could very much go back to corporate, but he has to work 4 jobs just to have insurance, just to have income, and to be present for his school-age daughter. If that didn't motivate me to do more across the board, yes, we need social capital, we need financial capital, yeah, we need more people who want to be allies. So not just the same communities being bombarded. We need you. What can you help us with? We need allies. We need extended allies. We need funding. We need legislation. We need it all across the board. And it's endless. So, and Elodie, feel free if you want to add more.
Um, well, first, I'd like to say that Children's Hospital has been pretty amazing with ER care for sickle cell patients. And that's not across the country. There might be maybe two other ERs in the country. I think there's one in Texas that does it too. But our ER director, when a child with sickle cell comes in at Children's Hospital, they're given what they need and then they assess the situation. So they get the pain medication. So it was a shock for me to go from Children's Hospital ER to Froedtert ER as an adult, because when I would go into the ER as a child and said that I had sickle cell, I would be taken back right away, and as an adult. And I've spoken to a few doctors who are advocates of sickle cell disease who would say that that sort of action for adult care can exist because we've done it for stroke, we've done it for heart attack, we've done it for different really critical needs. So there is a way to establish it in adult ERs. But to answer your question, Maria, I would say it's all of it across the country. Specifically in Wisconsin, like we've been saying, we're strong, but we need to be stronger. We have advocates, but we don't have a strong platform to discuss legislation that is up federally and how we can encourage our state senators to tap into the federal funding that is being brought by Senator Booker, for example, in Congress. We don't have a really strong research program. We have researchers that focus on sickle cell disease, and I know a few of them, but they need support. They need patients to participate in the research, that's where the education and community outreach piece comes in, and to encourage and educate and provide like trust for those patients to say, okay, I trust this medical system. I know it's a research. I know that it may or may not go well. If it goes well, then now there's added data. If it doesn't go well, there's still added data, and I've played a part in moving this agenda forward, but that requires a lot of education and a lot of trust that doesn't exist in the Black and Brown communities as it relates to healthcare. Funding, I mean, where do I begin? Funding for sickle cell disease, where funding comes with awareness, funding comes with advocacy efforts, funding comes with community and national pharmaceuticals and medical programs that are willing to really explain the importance of sickle cell disease. We have ASH, we have the NIH, we have the CDC, and the NIH has a Cure Sickle Cell Disease program that's happening. I would tell you that unless you're directly connected to the NIH, nobody in Wisconsin knows that there's a Cure for Sickle Cell program at the NIH. I would say I would be surprised if non-huge programs like Atlanta and Houston, aside from those big programs, if anybody else with sickle cell programs knew that the NIH had a Cure for Sickle Cell program. And so that's kind of all of it. It's all of it. There is lack of education. There is lack of awareness. There is a lack of support. And when you talk about allyship, I thought about a friend of mine who was born and raised in Mequon, and Mequon is her community. And when the George Floyd protest came out, she wanted to be in Milwaukee and she wanted to come out and support. And one of the community organizers told her to not do it in Milwaukee, to go back to Mequon. Go back to Mequon. Talk to them. They're the ones who need to know why they need to be allies in this work. So talking to sickle cell patients is not my goal. They know. They know how to care for themselves. They know what it requires to stay alive and survive and go to school and go to work. Their families know. I need to talk to the people who don't know. I need to get allyship to the people who need to hear this conversation more than 5 times and bring it to their pharmaceutical teams and their medical teams and their research teams. And I could keep saying academia really informs a lot in terms of treatments, legislation, and everything in between, and mental health. And so if, you know, we could start somewhere, that would be, I mean, we've started. We just need, like I said, we need more energy and capacity. Dora is tired. I'm gonna get tired soon. But yeah, it's a big community that requires a lot of effort.
Yeah, well, thank you so much for sharing all of this and for all of the work you do. And I can imagine this is only like a small snippet of, you know, all the work that's involved in this. So thank you so much for sharing with us.
Yes, thank you, Thomasina and Elodie and Dora, for your presentation and all of your work, your inspiration. It is amazing and so needed and welcome. I do think that, as you mentioned, individually, the work that you do, but you can hear in the stories that you tell too, the inspiration that you are spreading in the world, and in that way, making the work sustainable and carrying it out further and further to increase the number of people working on issues.
I'd just like to say, thank you, Kristen, for not only giving us this platform today to share, but also for believing in me from over 20 years ago, and really helping me to come into who I am and what I'm passionate about, and that is community engagement and the people within the community. So thank you for all of the support and the mentoring that you have provided for me for the last couple of decades.
I think those last words are good. Like what you mentioned, Elodie, how the responsibility, but also the capacity within an academic setting to, like, sometimes the work is slow, which, especially when there's urgency around a topic, slowness is like frustrating. However, it's just a way that within an academic setting, we have the ability, capacity, responsibility to influence our students, our communities, each other, faculty and staff, so that we are growing and moving towards advancing human flourishing. That's the word I like to use. So anyways, but thank you guys so much for coming. And if, you know, certainly questions for our guests, Dora's available, can get them out to Thomasina and Elodie. And we'll have the recording available, because I think especially the words and wisdom that have been shared could be really useful to many, many learners. And I just thank you for your time. Let's say right on.
Thank you.
Thank you.
Okay.
Take care, everyone.
Okay.
Thank you so much.
All right.